So I think we should get started. For the 5 of you in this room who are not faculty, and that's a little, if you want to help out. So
Flip it, you're going to teach us.
yeah, so let me start with, just because it's, so we'll take a moment here. So I'm Chris Strother. I am pediatric emergency medicine at Mount Sinai Hospital in New York City. And I am the director of simulation for our School of Medicine in our emergency department. And for the next 2 days, I'm the president of the Simulation Academy here at SAEM. And then I become the past president, which is fun. And what we're going to do today is we're going to spend the next few hours talking about debriefing, and particularly talking about challenging learners. So the idea here was a sort of debriefing 201 talk. And this came out of a conversation between some of our Sim Academy folks and some of the Cord folks. And I sent an email out and got lots and lots of these amazing, amazing faculty to volunteer their time and come out and help teach this. So I literally have 15 faculty for this workshop, which is unbelievable, and I am so thankful for every one of them that is here. And I had 20 learners, 19. Registered for this. We have 5 here. So you're going to get a really great hands-on small group experience. But you know, if more people come, that's great. If they don't, that's okay. So I think the plan is to talk for like 45 minutes at the most, and spend the rest of the afternoon basically in small groups, practicing debriefing, talking about different learner types, getting feedback, hearing stories from us old folks that have done this a bunch of times. And then at the end, kind of wrap up a little bit and just take questions and take stories and whatever it is you guys want to talk about. But we're hopeful to spend most of the afternoon practicing, like doing some actual hands-on work. But what I want to start with is sort of, you know, who are we? So let's start with the faculty. Briefly, if you could tell us, you know, who you are, where you're from, and what your sim role is. And we're down to 4. Sorry, this is awesome. I love you guys. Let's start over here. Yeah, with your Ernesto, go.
Fellowship trained, I don't know if
yeah, whatever you want.
I spent a year making myself.
Mirian Nadir, I'm the sim director over at the University of Illinois Jump Simulation, also the sim fellowship director, also fellowship trained. Happy to be here. I'm Lauren Conlon. I'm at University of Pennsylvania in Philadelphia. I'm the program director there, and run the simulation for the residency. We used to run the simulation for the medical students rotating on emergency medicine. I am a non-fellowship trained.
I'm Michael Sarah. I'm at Northwell Health in New York, based out of North University Hospital. Medical director of our simulation center. Fellowship director. I've never had done one, so.
Kimberley Schertzer at MACM Sim at Stanford, and our sim fellowship
I'm Mike Folk, formerly the fellowship director and simulation director at St. Louis Roosevelt. Just came back from 2 years in the corporate world, and now I'm part of Children's National Medical Center, trying to figure out where I go from here in my new career role.
Syria.
Sorry, that's right.
I'm Joan. I'm at WashU with Ernesto. I'm one of the APDs there as well. I kind of scraped together sim for a couple of years until Ernesto came, so it's great to have him in there. And then I did a MedEd fellowship, including a master's, and work with our students a lot with sim as well.
I'm Colleen Smith. I'm coming from Elmhurst and Mount Sinai in New York. I'm one of the APDs there. I did a sim fellowship at NYU, and
Danielle Hart. I'm from Hennepin in Minneapolis. I'm the program director, the sim fellowship director, and the
SAEM Center Director there, and I did a fellowship as well.
Well, go ahead and introduce yourself. One of our learners.
I'm Jed Leaf. I'm not faculty here. I'm one of the APDs at UT Southwestern in Dallas, and so I run our conference series and try to keep all the educational balls in the air.
Nice. Back table.
Not faculty. I'm Amanda Young. I'm at UAMS in Arkansas, one of the new clinical attendings. I am actually simulation fellowship trained.
I'm at North Shore University Hospital at Northwell Health. I'm Director of Medical Student Simulation there, also fellowship trained at Yale prior.
Andrew Restivo. I'm the Director of STEM Education at Jacobi in the Bronx. Also the APD for the program there, not fellowship trained.
I'm Mirian Kulkarni. I am the Program Director at St. John's Riverside Hospital in Yonkers. I also run all of the SIMs that happen at that institution, and I'm not fellowship trained.
Ambrose.
Ambrose Wong. I'm the Sim Research Director at Yale. I did a fellowship in simulation at NYU, and I have an education degree. And I'm interested in teamwork and patient safety. Happy to be here.
I'm Shannon McNamara. I'm in transition from being the Fellowship Director and ED Sim Director at Mount Sinai West St. Luke's to the same job at NYU. I'm fellowship trained, and I'm excited about this group.
I'm Kavita Joshi. I'm a learner here today. I am at UT Southwestern, and I am fellowship trained.
Yeah.
I'm from Taiwan, so obviously I'm not faculty, I'm a learner today. So I'm the director of the department, looking forward to some discussion and interaction with everyone here.
Great.
So, Jessica Ray, I am from Yale and the Center for Medical Simulation. I'm a PhD in human factors and just recently joined as a researcher at the university. Previous to this, I spent the last 5 years as an educator in the Simulation Center for our health system.
All right. Great. So we also just figured out who you are. So I can scan this slide a little bit quickly. So we have two fellowship-trained simulation folks. I myself never did a fellowship. They didn't exist so much back in my. So I'm old. I did a couple of days with Amitai Ziv in Tel Aviv, is the extent of my formal training, and lots of grandfathering and mentoring and things like this.
My fellowship was, would you like to do pediatric simulation?
Yeah. Yes, that was mine too. Hey, you're a peds guy. Sim experience, I guess, for the two of you guys not fellowship trained, are you doing sim? Are you teaching sim already? Do you help with simulation? Nods, yes?
Yeah, I do.
As in your APD role?
More, but yeah.
Ah, excellent. How about yourself? Do you do simulation at your center? Do you teach?
Simulations, but currently there's no simulation fellowship in.
Very good. Very good. Okay. And for the two of you who have not done the formal training, do you know the phrase debriefing with good judgment or advocacy inquiry? Are these familiar to you? It's a sim test.
Is that like to be nice?
Close. Very close. Very close. Good. Okay. So now we got our audience here. So I have a feeling so I'm plotting in my mind here. So what we're going to do is spend a little bit of time talking, and for the sim fellowship folks, this will be a little review. For the non-trained folks, it'll be some of it will be more new. And we're going to talk about sort of the pre-brief, right, setting the scene, making people understand what's going on, a little 101 review of the different debriefing techniques and terms that are out there, and a little bit about making sure, thinking about your own teaching and how to reflect on it. I'm going to run through some of the archetypes that we're going to be talking about today. And then I think what we'll do for our small groups, if this is okay with you guys, is I'm going to put the two fellows trained people together and the two non-people together when we do our small groups, because that way we as faculty can tailor our case and our debriefing to you guys and your level, and it'll be a little bit different conversation. I think that makes the most sense. And then, we're going to practice. We're going to give you a case, have you debrief it, make it easy or not easy on you, and talk about how to deal with those different learner types as we move around.